have been diagnosed with sciatica, if you feel pain, numbness, and tingling sensation in your lower leg and in your foot, the constant question still remains: what should you use? Hot compress or cold compress to help alleviate your symptoms? In this video, I will tell you what to correctly use, when to use it, and why. So if you're looking for natural ways to get rid of sciatica symptoms, this video is for you. Hi, this is again Doc Sherry, Doctor of Physical Therapy. I'm glad to have you here. Do you know, when we talk about sciatica, it is not purely muscular in nature. A nerve is involved. That's why it's wrong for you to use hot or cold compress without understanding the rationale behind it. Now let's get to the point. When should you use cold compress? You are going to use cold compress like this, especially during the acute stages of back pain, sciatica, or during an acute injury. Preferably within the first 48 hours, we use cold compress. Cold compress is also recommended if you notice that there is swelling or there is inflammation in your lower back area. Now, the reason why we are going to use cold compress in those cases is because cold is very effective in decreasing inflammation. Plus, it also has the capacity to soothe out irritated nerves. Now, how do you properly use cold compress? Very simple. You just wrap this in a towel before you put it in your lower back area. Let it stay there for 15 to 20 minutes, and you can do this 2 to 3 times a day. This can help you get rid of the pain. Now, when is the proper time for you to use hot compress? By the way, this is the hot compress that I usually recommend to my patients because it is very light, it is flat, it can cover well a large surface area in your lower back. And it has a timer in which you can set the temperature and the time. So very convenient to use. You are going to use hot compress in long-standing back pain and long-standing sciatica. Especially if you also notice tightness and stiffness in your lower back and in your hip joint. Especially if in your result you have seen muscle spasm written there. The heat actually relaxes your muscle. At the same time, heat would help with improved blood circulation, which is needed for pain relief. So how do you properly use hot compress? Simple. You also cover it with a towel before putting it in your lower back. Have it stay there for 15 to 20 minutes, and you can also do that 2 to 3 times a day. This will help reduce your symptoms. If you find this practical information helpful, I would really appreciate it if you can take only 1 second of your time to please click the like button below as your way of supporting this channel. Now, here is a common mistake that others actually do. They immediately use hot compress even in the early stages of injury, and daily they are using hot compress even if there is swelling or there is redness. So as a rule of thumb, if you are confused, always remember this. During the early stages of pain, especially during the first 48 hours, if there is redness, if there is swelling, use cold compress. If you are experiencing chronic low back pain and chronic sciatica, hot compress will help you, especially if there is muscle tightness. Now, here is the truth that you also need to know. Although both hot and cold compress can help you with the pain, it does not work directly on your damaged nerve. Based on my experience in the patients that I treat with sciatica and who have managed to relieve their symptoms without spinal surgery, you need to partner it with exercise. Because the purpose of the exercise is to actually decompress impinged nerve, which is the root cause of sciatica. And it is based on your X-ray or your MRI result. However, if you haven't had your X-ray or MRI done yet, it is based on the position of the spine which relieves you of your symptoms. If you want to know the proper exercises that will help you, that you can do at home, check this video here. I will put it also in the description link below to help you. At the same time, we need to avoid foods that will further aggravate inflammation in the body and inflammation to the nerves. We also have it here. You can check on it later, and you need to be educated. I really take time with patient education because you need to understand the positions that you need to avoid so as to make sure that the result in your x-ray and in your MRI will not worsen. We have a video here, check on it, because some household activities can actually trigger sciatica symptoms if you did it wrong. If you have reached the end of this video, please comment your age and where you are from, because actually certain age groups are more predisposed to certain causes of sciatica. Thank you very much for watching. I will see you on our next video. God bless you.